Your gynecologist has recommended that you undergo surgery to remove vaginal fibroids. But what does that actually mean? The uterus is a part of the woman's reproductive system. It's the organ that contains and protects a growing fetus during pregnancy. Fibroids are non-cancerous tumors that grow from the inner or outer wall of the uterus. They are quite common. As many as 20% of women over 30 will develop fibroids sometime during their lifetimes. In most cases, fibroids do not cause any discomfort and are never detected. Occasionally, however, fibroid tumors can cause problems. Complications from fibroid growth can include pressure on the urinary system, pressure on the intestines, interference with the reproductive system, or infection. Because these tumors can grow to be very large, surgery is usually recommended in order to restore health and to protect the uterus. For the treatment of fibroids, there are no real alternatives to surgery. Should you decide not to undergo surgery, it is unlikely that the discomfort you are feeling will subside on its own. There is also the risk that the fibroid or fibroids could continue to grow. If left unchecked, fibroids can permanently damage the uterus or other organs. On the day of your operation, you will be asked to put on a surgical gown. You may receive a sedative by mouth, and an intravenous line may be put in. You will then be transferred to the operating table. To perform this procedure, your doctor will need unobstructed access to your uterus, so your feet will be raised, separated, and placed in canvas slings, holding your legs in a position much like that position used during a routine gynecological exam. And sterile towels are draped around until only the vulva is exposed. Then the surgeon will use a gloved hand to conduct a vaginal examination and will check the size and location of the uterus by pressing on the lower abdomen. Your doctor will then use a retractor to open the vagina. Once the cervix is visible, forceps are used to grasp the front lip of the cervix and to pull it forward, causing the uterus to open. Through that opening, your doctor will insert an instrument called a hysteroscope. A hysteroscope allows the surgical team to insert all necessary optical and surgical instruments into the uterus. At the beginning of the procedure, a harmless gas or fluid will be introduced into the uterus, causing it to expand. By inflating the uterus slightly, your doctor is better able to reach the operative site. Next, a wire loop is inserted. This loop is used to grab the fibroid tissue and snip it free from the muscular wall of the uterus. When your doctor is satisfied that all fibrous tissue has been removed, the hysteroscope and all other instruments are withdrawn. The gas or fluid is allowed to escape, and the uterus returns to its normal shape. Most patients experience at least some pain following surgery, but if properly handled, it shouldn't present any serious problems. Pain used to be regarded as an unavoidable side effect of surgery, but today, pain can be managed with great effectiveness. And as the patient, you have an important role to play. Before surgery, be sure to ask the medical staff about the type and duration of pain normally associated with your surgery. Find out in advance about your pain management options. Work with the staff to develop a pain management plan. Discuss your options. There are alternatives to drugs that can lessen your need for pain medication. Ask your doctor for help in finding a pain management class. Many of these workshops teach helpful relaxation techniques, positive thinking, and nerve stimulation exercises. Following surgery, make sure to let your nurse know right away how you're feeling and whether or not you are in any pain. Be specific and help them to measure your discomfort. If you're having trouble expressing yourself, try to rank what you're feeling on a scale from 1 to 10. Never be shy about asking for help. If you experience pain that just won't go away, report it to the nurse. Pain is an important indicator that helps you and your medical staff understand your body's healing process. Vaginal fibroid removal surgery only rarely leads to complications. Possible problems include infection, excessive bleeding, accidental injury to the uterus. In some cases, fibroid tissue returns and must be removed surgically. In a very few patients, the cervix may remain partially dilated or slackened, a condition that can lead to spontaneous miscarriage during pregnancy. Because no incision has been made, patients recover from fibroid removal surgery relatively quickly. As with all surgery, you should be alert for signs of infection, increased swelling, redness, bleeding, or other discharge,